Hello, friends. Today we're going to talk about a very important topic that unfortunately isn't discussed much: penis health. Yes, you heard that right. I know it sounds a bit awkward when I say it so directly, but here's the truth. Just like every organ in your body is important and requires care, the health of your penis is equally important. But unfortunately, men aren't very aware of this topic. In fact, most people don't even think about it until they experience a problem. So in today's video, I'm going to tell you everything you need to know about penis health. We'll talk about everything from hygiene to nutrition, from exercise to protection. If this is your first time watching this video and you want to stay informed about this kind of content, please subscribe to the channel and turn on notifications. Now grab your coffee, get comfortable, and let's get started. Look, let's start with the most basic topic first. Hygiene. You might be saying, what hygiene? I shower every day anyway? Okay, great. Showering is important, of course, but it's not enough. The penis area is one of the most sensitive areas of your body, and it needs special care. Especially if you're uncircumcised, this is even more critical. Because under that skin layer called the prepuce, moisture can accumulate, bacteria can breed, and bad odors can form. There can even be an accumulation of a whitish substance we call smegma. This isn't just unhygienic, it also increases the risk of infection. So what should you do? You need to specifically clean your penis when you shower every day. If you're uncircumcised, gently pull back that skin and wash underneath with warm water. If you're going to use soap, avoid very aggressive perfumed soaps, because that area is very sensitive and can get irritated. Use unscented, pH-balanced soaps. And here's a very important detail after washing. Dry yourself. Yes, drying is very important because a moist environment is bacteria, and fungi's favorite thing. Gently dry yourself with a soft towel, and make sure the area is completely dry before putting on your underwear. Now, let's talk about underwear selection. Look, this is a very underestimated topic, but it's incredibly important. Most men wear tight boxers or briefs made from synthetic fabric. Then they wonder why they're sweating, why they feel uncomfortable. Let me explain now. There's a reason your testicles are outside your body, because sperm production requires a temperature slightly lower than body temperature. When you wear tight, non-breathable underwear, the heat in that area increases, sweating occurs, and moisture accumulation begins. This isn't just discomfort, it also affects sperm quality. So what should you do? Choose underwear made from cotton, breathable fabrics. Avoid very tight ones. Boxer type might be more comfortable, but that's completely your preference. What's important is that the area is comfortable and can breathe. And let me tell you this, especially in summer or after exercising, change your sweaty underwear immediately. Walking around in sweaty underwear for hours is like inviting an infection. Now let's get to the nutrition topic. Yes, what you eat also affects penis health. How? Let me explain. The foundation of erection is blood circulation. Blood needs to flow easily to the penis for you to achieve a healthy erection. If your arteries are clogged, your blood circulation is slow, your cholesterol level is high, all of these negatively affect erection. So foods that are good for heart health are also good for penis health. Green leafy vegetables, for example, like spinach, arugula, parsley. These help with nitric oxide production and dilate blood vessels. Red fruits, like strawberries, raspberries, pomegranate. They're rich in antioxidants and improve blood flow. Fish rich in omega-3 like salmon, mackerel. These are good for vascular health. Nuts like walnuts, almonds, hazelnuts. They contain vitamin E and healthy fats. Garlic and onions. Yes, they can cause odor, but they're great for blood circulation. And don't forget this. Drink plenty of water. Dehydration, meaning being without water, reduces blood volume, and this can affect erection. Try to drink at least 2 to 3 liters of water per day. Now let's get to things you should avoid. Excessive alcohol consumption. Yes, 1 or 2 glasses is fine, but excessive alcohol can lead to erection problems by affecting your nervous system. Cigarettes. Look, this is really very important. Cigarettes narrow blood vessels and reduce blood flow. In the long term, it can cause serious erection problems. Excessive sugar and processed foods. These lead to insulin resistance, obesity, and eventually blood circulation problems. Now let's talk about exercise. Physical activity is critically important not just for your general health, but also for your penis health. Why? Because exercise improves blood circulation, keeps your testosterone level balanced, reduces stress, and provides weight control. So, what kind of exercises should you do? Cardiovascular exercises, like running, swimming, cycling. These directly affect heart health and blood circulation. Try to do cardiovascular exercise at least 3 to 4 days a week, 30 to 40 minutes. Kegel exercises. Yes, these aren't just for women. They're very important for men too. I explained in detail in my previous videos, but let me remind you briefly. By strengthening the pelvic floor muscles, it increases erection quality and improves ejaculation control. How to do it? Tighten that area as if you're holding your urine, hold for 3 to 5 seconds, then release. Do 3 sets per day, 10 to 15 repetitions in each set. Weight training. Especially leg exercises can increase testosterone production. Movements that work large muscle groups like squats, deadlifts contribute to hormonal balance. But be careful. Excessively heavy weights and excessive strain can have the opposite effect. Be balanced. Yoga and stretching exercises. These improve blood flow, reduce stress, and increase your body's overall flexibility. Now let's get to weight management. Excess weight, especially fats accumulated in the abdominal area, seriously affects penis health. How? First, obesity lowers testosterone levels and raises estrogen levels. This leads to a decrease in sexual desire. Second, excess weight damages vascular health and worsens blood circulation. Third, fat accumulation in the abdominal area can make the penis appear visually smaller. Yes, penis size doesn't change, but it's hidden by fat tissue. Fourth, obesity increases diabetes risk, and diabetes can lead to nerve damage causing erection problems. So being at a healthy weight is critical not just for your general health, but also for your sexual health. Now let's touch on a very important topic: stress and mental health. Look, penis health isn't just a physical issue. Psychological factors are also incredibly effective. Stress, anxiety, depression, sleep disorders, all of them affect sexual performance and penis health. Chronic stress increases cortisol levels, and this suppresses testosterone production. Anxiety, especially performance anxiety, directly affects erection. Because erection is controlled by the parasympathetic nervous system, meaning you need to be relaxed. When you're anxious, your body goes into fight or flight mode and erection becomes secondary. Depression both reduces libido, and some antidepressant medications can affect sexual functions. Sleep disorders reduce testosterone production because testosterone production largely occurs during sleep. So what should you do? Learn stress management techniques, like meditation, breathing exercises, mindfulness. Regular sleep. 7 to 8 hours of quality sleep every night is very important. Get professional support if necessary. Don't hesitate to talk with a therapist or psychologist. Talking about sexual health isn't something to be ashamed of. Now let's get to regular checkups. Look, just like you get regular maintenance for your car, you need to get maintenance for your body in the same way. Especially if you're over 40, you should have a urology checkup once a year. Prostate health, testosterone levels, tests for sexually transmitted diseases, all of these are important. And don't forget this: if you're constantly experiencing erection problems, if there's a serious decrease in sexual desire, if you see symptoms like pain, swelling, redness in the penis, if you feel burning or pain when urinating, if there's abnormal discharge, go to the doctor immediately. These can be signs of serious problems, and early intervention is very important. Now let's talk about other things to pay attention to in daily life. Avoid bathing with very hot water. Excessively hot water negatively affects testicular health. Don't use your laptop on your lap. Both heat and radiation can affect testicular health. Avoid very tight pants. Tight clothing restricts blood circulation and causes heat increase. If you ride a bicycle for very long periods, choose the right saddle. The wrong saddle can cause nerve damage by pressing on the perineal area. Avoid chemical exposure. Reduce drinking water from plastic bottles. Prefer organic products because some chemicals can disrupt hormonal balance. Now, let's talk about frequency of sexual activity. Look, regular sexual activity is actually beneficial for penis health. Why? Because regular erections keep penis tissue healthy, activate blood circulation, and apply the use it or lose it principle. Meaning the penis is like a muscle. If you don't use it, it weakens. But B, careful, excessive masturbation or very frequent sexual activity can also create problems. Balance is important. Sexual activity or masturbation 2 to 3 times a week is considered healthy, but this varies from person to person. What's important is listening to your body. And let me make an important warning about porn. Watching excessive porn can affect brain chemistry and lead to performance problems in real sexual intercourse. Because the brain gets used to excessive stimulation and normal stimuli start to seem insufficient. This causes erection problems, decrease in sexual desire. So limit porn watching and focus on real relationships. Now let's touch on supplements and vitamins. Some vitamins and minerals are important for penis health. Vitamin D, critical for testosterone production and vascular health. Its deficiency is very common, especially in people who don't see the sun. Zinc, important for testosterone production and sperm quality. Found in red meat, shellfish, and seeds. Magnesium, regulates blood pressure and supports muscle functions. Found in green leafy vegetables, nuts. L-arginine, dilates blood vessels by increasing nitric oxide production. Found in red meat, chicken, fish, and legumes. Omega-3 fatty acids, important for vascular health and blood flow. Found in fish, walnuts, and flaxseed. But be careful, definitely consult a doctor before taking supplements, because excessive intake or wrong use can be harmful. Now let's talk about changes that come with age. Look, aging is a natural process and some changes happen in penis health too. Testosterone levels gradually decrease, blood circulation can slow down, erection duration can shorten, recovery time can lengthen. But these are normal and acceptable changes. What's important is accepting these changes and adapting. If an erection that used to last 20 minutes now lasts 10 minutes, this is normal. If you could do it several times a day before and now you can do it several times a week, that's also normal. Don't compare and don't pressure yourself. What's important is quality, not quantity. And finally, I want to say this. Penis health isn't just about sexual performance. It's an indicator of your general health. Erection problems can sometimes be early signs of heart diseases, diabetes, or hormonal disorders. So, taking penis health seriously actually means taking your general health seriously. If you start applying everything I told you today to your life, pay attention to hygiene, eat right, exercise regularly, deal with your stress, stay at a healthy weight, go for regular checkups, believe me, you'll feel the difference. You'll see great improvement not just in penis health, but in your overall quality of life. Remember, a healthy life is the foundation of a healthy sex life. Now, if you found this video useful, please like, comment, and share. Don't forget to subscribe to my channel because this kind of useful content will continue. See you in the next video. Take care of yourselves.